at lunchtime today, he came over to check on his father.
Okay. And does the patient live alone, and or are there other family members who just aren't there?
Patient lives alone.
Okay. And are there any psychological issues or any social or family concerns?
The wife recently died, and the father has been depressed or seemed depressed since the wife has passed.
Okay, do I have, I want to go back to the medications for a second. Are there any indications from the medications here that they're being taken at the right time? I mean,
the son reports that he gives the medication when he's there, but his father's responsible to take the medication when he's not there.
Okay. And in terms of the narcotics, do we have the vial for that? And
the son will go look for the bottles for you.
Okay. All right. Well, then I'm going to want to follow up on that in a few minutes. How about the vital signs now? My partner was taking vital signs. What do I have for pulse?
The pulse is 58.
Okay. Is it regular?
And regular.
Okay.
Respirations?
Yeah. Yes. Respirations. What are they?
12 and shallow.
How about his? I'll do lung sounds.
Clear, equal bilaterally.
I put the patient on, I get O2 sat.
Pulse ox is 92.
And blood pressure?
100 by palpation.
Okay, I feel his skin. What is it looking like? Is it cool? Is it warm?
It's cool.
And
pale
moisture?
And moist.
Pale and moist. And his pupils. What kind of response do I get?
You're sluggish.
Slow to respond. I'd also go ahead then and I'd place this patient on a cardiac monitor.
Sinus bradycardia.
Okay, we have him on oxygen at this time. I would still be concerned about.
Excuse me, can you clarify for me how much oxygen when you say some oxygen?
I have him on 15 liters non-rebreather, and I would be monitoring his airway because originally I think I marked that his respirations were 12 and shallow.
Yes.
So if his respirations get any more shallow or the rate drops, I'd be concerned about this, and I'd probably want to go ahead and go to a bag valve mask and assist ventilation with high flow oxygen.
Okay.
But at this time, I'm just going to keep him on the non-rebreather. And I need to go ahead and start an IV for this patient and go ahead and do a blood draw so that I can go ahead and get a Dexy on him.
Okay, dextro stick is 45 milligrams per deciliter.
45, okay. All right, given that this patient is a diabetic and he may not have eaten in 18 hours and his level of consciousness is poor, and his Dexy is very low, I would want to go ahead and, I have a line established normal saline KVO. I'd want to go ahead and give him dextrose. I give him 25 grams of D50. Okay, now that we've given him the Dexy, I'd like to go ahead and package this patient. I view this patient as being a priority patient for transport. My engine company should have arrived at this point.
We have sufficient help.
Then we're going to go ahead and prepare him for transport. I'm either going to go ahead and place him directly on a stretcher if it could fit into the room, but if I couldn't get there, I might have to place him on a Reeves stretcher, move him on out to the cot, and then package him and move him to the unit quickly. When I get to the unit, I would want to go ahead and repeat the Dexy to go ahead and find out whether or not I've seen any change there.
The dextro stick is now 100.
Okay, so did the patient's other conditions change? Like his level of consciousness, has that improved? Respirations?
There's no change in patient condition.
Okay. Okay, I'd also like to go back to an item before. I had asked the son to go ahead and get me the medication. He was searching for a couple medications. One of them was the Percocet. Did he find the vial for that yet?
The son brings you out the medications and hands them to you, and the Percocet bottle is empty.
It's empty. Okay. All right, given that this patient hasn't responded to the Dexy or to the glucose that I gave, I think I'm going to go ahead and treat him as a possible narcotic overdose. So I'm going to want to administer Narcan, 2 milligrams. I'll start it in 0.4 milligram increments, titrated to effect up to 2 milligrams of Narcan. And I'd want to go ahead and repeat, I'd want to repeat my vital signs after that, of course. Do I get any response to the Narcan, this patient?
After Narcan administration, which response are you looking for?
Level of consciousness.
Patient will now look in your direction when you speak to him and will respond his name.
Okay. All right. And if I ask other questions, he's not responding well to
Not
additional
appropriately.
questions. Okay. I'd expect that. Okay. How about the other vitals? How about pulse at this point?
Pulse rate is 66 and regular.
Okay. And on the monitor, just seeing a normal sinus.
Sinus,
And how about respirations?
16.
And O2 sat?
O2 sat is now 99.
Okay. And blood pressure?
Blood pressure is 118/78.
How about his skin? Is he improving? Is he still cool, moist, pale?
His skin is still cool and moist.
Okay. Okay. I'm ready to go ahead and begin transport of this patient at this time. So I'm pretty sure I know what my field impression is on this patient. Should I give that to you now?
Yes, please. What is your field impression and why?
I think this patient is a hypoglycemic patient. I also think he is suffering a narcotic overdose, may have overdosed on the Percocet. I base this on the fact that his initial level of consciousness was unresponsive when we arrived. We administered the